Hello Physios, welcome to Believe in Therapy. I am Dr. Neha and today I am going to discuss 100 MCQs on a fracture. So this video is very important for all competitive exam like Aiims, GSSSB, MPESB, DSSB and other because fractures are a frequently asked topic. Usually 2 to 5 questions come from these parts. So today we will clear all your doubts on these questions. So you already know that in last videos I explained fractures in a detail, so make sure to watch that videos before this one, and it will make these MCQs much easier to understand. So this link is available in our description box. And if you are new to this channel, so don't forget to subscribe. Come to our first questions. Neck of femur fractures commonly lead to which complications? So this is a very important and repeatedly asked MCQs in all competitive exams. So it's given a options like fat embolism, avascular necrosis, and compartment syndrome, and foot drop. So AVN is a major complication seen in a neck of femur fractures because the blood supply of femoral heads mainly come from a retinacular arteries, and in neck of femur fractures, so these vessels get damaged. So when a blood supply reduces, so bone tissues dies. So that is called as a AVN necrosis or avascular necrosis. Okay, so the common high risk of a neck of femur fractures is a AVN. So B options given are correct options. Now come to a second questions. Intertrochanteric fracture usually occur between. So is question asking like a basic anatomy questions. Intertrochanteric fracture is an extracapsular fracture and the fractures line pass between a greater and lesser trochanter. So given a B options is a correct options, greater and a lesser trochanter, because it's a extracapsular pattern and blood supply is usually preserved, so healing is better compared to the neck of femur fracture. And common questions asking is intertrochanteric fracture or a neck of femur fractures. Okay, so main as a difference is a intracapsular or a extracapsular. So given a B options is a correct options, intertrochanteric fracture lies between the greater and the lesser trochanter. Okay, so now come to a third questions. Subtrochanteric fracture is located in a. So subtrochanteric, is a very common one-line question. Subtrochanteric fracture is lies below to the lesser trochanter up to a 5 centimeters of a femoral shaft. So given a C options is the correct options, below lesser trochanter. So lesser trochanter like up to about a 5 centimeter of femoral shaft. Okay, so this areas like a high mechanical stress and a poor blood supply. So as a commonly chances here like a delayed union or a non-union. Okay, so I think clear. Now come to fourth questions. Fourth question is most common direction of a posterior hip dislocation. This is a common question asking like usually MCQs, but frequently are repeated questions. Most common directions of posterior hip dislocation is means femoral head is a dislocated on a backward. So given a like backward directions, options given are inferior, anterior and posterior. So C options given are correct options. Posterior hip dislocations means the femoral head like goes up backward, so direction is obviously posterior. So now can add this like one line. Posterior hip dislocations commonly happen due to dashboard injuries in RTA cases. So I think clear. C options given are correct options. Now come to fifth questions. Patellar fractures most commonly occur due to. So patellar fractures like patella is a superficial bone. So when someone fall directly on a knee or get hits on a knee, so seen as a patella like a fracture is because this like superficial, so absorb a force. So seen as a like direct blow to the knees. Correct options given are B options. Okay, आई थिंक क्लियर. नाउ कम टू 6 क्वेश्चन. थोड़ा फास्ट कवर करेंगे क्योंकि इस वीडियोस में हम 100 क्वेश्चंस कवर करेंगे. सो टिबियल प्लेटो फ्रैक्चर्स प्राइमरली अफेक्ट. सो टिबियल प्लेटो like is a very important clinical exam questions. Tibial plateau form like upper articular surface of tibia. So directly participates in a knee joints. So when these fractures occur, so knee joint surface get a damage. So options given are like knee articular surface, like B options given are correct options. Okay, because this area like articular surface of tibia and directly participate to the knee joints, so knee articular surface is a injured area. Okay, that's why because knee seen as a knee stiffness, and early osteoarthritis and instability. Okay, if are not proper treated, so seeing this type of complications. Now come to our seventh questions. Most common complications of a tibial shaft fractures. So tibial shaft actually is a very commonly repeated MCQs. The tibial shaft has a less soft tissues covering and poor blood supply in a middle third area. So as common complications seen as a delayed union. B options given are correct options because is a areas like a less soft tissues and a poor blood supply. Okay, so healing become a very slow, leading to a delayed union. Okay, so I think clear B options given correct options. And TB is like subcutaneous bones, so complications are more common compared to the other long bones. So B options clear. Now come to 8 questions. Isolated fibular fractures usually treated by. So fibular fractures is a fibula is very rare because fibula is a non-weight bearing bone. So if only a fibula is fractured and tibia normals, then usually treatment as a rest and crepe bandage and short leg casting are enough, and surgery is not required in most cases because fibula नॉन वेट बेरिंग है सो इसको मैनेज हम कंजर्वेटिवली कर सकते हैं. सो सी ऑप्शंस गिवन है करेक्ट ऑप्शंस. ओके, not need any surgery or in long functions hip spica, so C options correct options. Now come to our ninth questions. Pods fractures involve. So this is very favorite exam questions. Pods fractures means like a bimanular fractures of a ankle, means a lateral malleoli or a in ball as a medial malleoli. So C options given are correct options, both malleoli. Okay, and at this points both when both side of ankle are broken, so ankle become unstable, so this called as a Pods fracture. Okay, C options given are correct options. Now come to a 10th questions. Cotton fractures is. So cotton fractures are also called as a trimallular fractures. So A options given are correct options. Trimallular means cotton fractures involve medial malleolus, lateral malleolus and posterior malleolus so it's all three malleoli involvement, so it's called as a trimallular fractures. Okay, now come to other questions as a 11th question. Masonry fractures is associated with injuries. So this is a very commonly asked in clinical exam and repeated question. So masonry fractures means ankle injuries and syndesmotic injuries. So common seen fractures in a proximal fibula, upper fibula. So A options given are correct options. Proximal fibula. Okay, so always remember this. If a type of masonry fractures so commonly seen is an ankle problem, but fractures found are near to the knee joints. Okay, so I think clear. Now come to 12th questions. Pilot fractures involves. So pilot fracture actually affect the lower end of tibia, especially the ankle joint surface. So that's why it's also called as a tibial platform fractures. And the options given are correct options. Distal tibial articular surface. Okay, because it's damaged joint surface, so stiffness is common and rehabilitation, if rehabilitation is poor, so the options correct options. I think is it clear? Now come to our 13 questions. Aviator fractures refer to fractures of. So aviator fracture actually one line questions and repeated question, and aviator fracture is actually seen as a talus neck fractures. So A options given are correct options because it's a commonly seen in pilots during aircraft crash injuries. So A options given are correct options. Okay. Now come to other questions of 14 questions. Chopard fractures dislocation occurred. So Chopard fracture as a very favorite anatomical or ortho combined questions. So Chopard fracture actually talonavicular or calcaneocuboid joints, so it's called as a mid-dorsal joints, as a common seen in a talonavicular or calcaneocuboid. So B options given are correct options, mid-dorsal joint. Okay, so injury is a midfoot. B options given are correct options. Now come to 15 questions. Zones fracture involve fracture of. So zone fracture is a very high yield sports injuries. Zone fracture base of fifth metatarsals is called as a metaphyseal or diphyseal junctions. Okay, so B options given are correct options. fifth metatarsal bone. Actually, zone fracture seen as a fifth metatarsals and stress fractures also seen here. Okay, so important points like John's fracture is healing slow because risk of non-union. Okay, so B options given are correct options. Now come to a 16 questions. Marsh fracture is also known as. So marsh fractures commonly repeated MCQs, and marsh fractures like due to repetitive overuse, long walking, and like a soldier or a military training. So correct answers given are stress fractures of a metatarsals. And marsh fracture is common seen as a second and third metatarsals, commonly as a second metatarsals. So B options given are correct options is a stress fractures of metatarsals. Now come to a 17 questions. Most common fracture of talus occurrence. So is a very standard ortho MCQs like talus have a three parts: body, neck, and head. So talus fractures is most common seen in a neck of talus. Okay, because common chances of a avian because blood supply get disturbed. So C options given a correct options neck fractures most common site. Okay, so C options given a correct options. Now come to 18 questions. Navicular fracture is important because it's affecting. So navicular fracture actually seen in areas like a key bone as a maintain a medial longitudinal arch of foot. So navicular is fracture, so arch is collapsed and flat foot may be developed. Very useful. So B options given a correct options foot arch. Navicular fractures is important because it's affect the foot arch. Okay, so like a navicular is a very important and key bone for maintain of arches. So B options given a correct options. Now come to a 19 questions. Toe phalangeal fractures are commonly caused by. So toe phalangeal actually is most common cause of hitting toe against a bed like a door and furniture and any of the sports injuries. So it's like a diet trauma or starving is like a. So I think clear. Now come to 20 questions. Mallet fractures due to injury of. So mallet fractures like a sudden force hit a tip of finger and extensor tendon like pull a small bones fragments from a distal phalanx. So B options given a correct options extensor tendon insertion. Okay. So now come to 21 questions. Garden type 2 fracture of neck of femur is. So garden classification actually is a part of a neck femur fractures, neck of femur fractures. Okay, so is a very frequently asked in an exam, and garden classification have a four types of type 1, type 2, and type 3 and type 4. So type 1 is incomplete valgus impacted, and type 2 is completely but undisplaced fractures. So options given are C options is a correct options complete fractures without a displacement, and type 3 is a complete fractures with a partial displacement, and type 4 complete with a full displacement. So remember these points. Garden type 2 fracture is complete but alignment is still a maintained. So C options given a correct options. Okay, next come to Powell type 3 fractures of a neck of femur is characterized by. So Powell classification is based on a like angle of inclinations. Okay, so type 3 fracture actually is a worst prognosis, and worst prognosis so seen is a higher risk. So A options, C options given a correct options because in angle of inclinations like a fractures line, if angle is higher like 50, so more shear force effect of a neck of femur. Okay, so more shear force like more instability, and if a more instability so higher risk of a non-union. So always remember these points. Come to our 23 questions is important questions. Yvonne classifications type 1 intertrochanteric fracture is considered. So Yvonne type 1 fracture actually Yvonne classifications type 1 and type 2. So type 1 seen as a stable fractures, and type 2 is a unstable fracture. So stable fracture have like a better reductions and a better healing and better outcomes. So type 1 intertrochanteric fracture actually is a stable fracture. So C options given a correct options. Okay. So I think clear. Now come to our 24 questions. Thompson Absence type 5 posterior hip dislocations involved in. So जितने भी types और classifications हैं, so please note down this. This is very important. Thompson's absence type 5 actually classifications on a posterior dislocations. So type 5 is a fractures of a femoral head. So given a second options, B options is a correct options. Okay. Now come to 25 questions. Surgical type 2 tibial plateau fractures. So actually surgical is a very commonly repeated MCQs. Surgical classifications like type 1, type 2 and type 3. So type 1 means a pure split type, and type 2 is like a split plus a depression seen is here, and type 3 is a pure depressions. Okay, so question asking a type 2. So type 2 is actually is a combinations injuries, pure split and depression, so it's called as split plus depressions. So split plus depression as a C options given a correct options. Okay, now come to our 26 questions. AO classifications 42A3 fractures of tibial shaft represent. So the new pattern MCQs commonly seen in a recent exam. Okay, so AO classification like a 42 and A and for A3. Okay, so there are three types. 42 means a tibial shaft, and A for a simple fractures, and A3 means a transverse pattern. So question asking like AO classifications A2 से A3 like 42 से A3 जो fractures of tibial shaft represent. So tibial shaft represent actually tibial shaft fracture is a transverse fracture. So simple B options given a correct option, simple transverse fractures. Okay, are they clear? Now come to 27 questions. Weber type C ankle fractures indicates. So Weber classifications actually is important. Classifications of our ankle joints. So Weber classifications type A and type B and type C. So question asking are like type C. So type A Weber classifications is below to syndesmosis, and type B is at the syndesmosis area. Type 3, type C means above syndesmosis. So questions like options given are fractures above syndesmosis. So C options given are correct options. Okay. Now come to our 28 questions. Laws Hansen classifications. Supination external rotations injuries most commonly result in. So Laws Hansen classifications important classifications seen as a supinations external rotations injuries called as a SER injuries. Okay. So SER injuries are the most commonly seen like a type of a spiral fractures on a seen in the ankle joint like a malleoli, seen as a lateral malleoli, then medial side structure get injured. So options given are C options like lateral malleolus and seen as a spiral fractures first. Like in supination external rotations injuries, stubborn is spiral fractures of lateral malleolus, then medial side structures get injured. So first is lateral malleoli. Okay, so C options correct options. Now come to 29. Says Hawkins type 2 talus fractures include. So his very favorite classifications, Hawkins classifications. So Hawkins classification is a talus classification. So seen as a type 1, type 2 and type 3 and type 4. Question asking a type 2. So type 2 is a neck fractures with a subtalar dislocations. Okay, so options given are like a B options correct options subtalar dislocations with a neck fractures. Type 1 fracture actually undisplaced neck fractures, and type 2 neck fractures with subtalar dislocations, and type 3 is a neck fractures plus subtalar plus ankle dislocations, and type 4 is very severe like a talonavicular dislocations. So B options given are correct options. Now come to our 30 questions. Important questions. Diamond classifications of a zone fractures type 3 represent. Okay, so is a recently trending recently asked in an exam. This questions is very important. Dameron classifications have a three types: type 1, type 2, and type 3. So the zone fractures classifications: type 1 as a acute fractures, type 2 is a delayed union, and type 3 is a chronic fracture, actually a non-union. Okay, so question asking here like type 3. So C options given a correct options: non-union plus a chronic fractures. Okay, so I think as a clear. Now come to a 31 questions. Most common directions of anterior shoulder dislocation. So anterior shoulder dislocations is very common, and different type positions like subcoracoid, subglenoid, and subclavicular. So it's common as a subcoracoid. B options given a correct options. Most common in the subcoracoid dislocations. Okay, so I think clear. B options given a correct options. Now come to a 32. Vankart lesion involve injury too. So Vankart lesion actually tearing of labrum, like a anterior inferior part of glenoid labrum. So options given are posterior, superior, and inferior. So C options given are correct options. Anterior inferior labrum tearing. Okay, because of this tearing, like shoulder become unstable and recurrent dislocations happen. So C options given are correct options. Now come to a 33 questions. Hill such lesion of. So hill such lesion actually is a very common MCQs. Is a compression fractures and seen as a posterior lateral aspect of humeral head. So B options given are correct options because humeral head hit a glenoid rim. So is a bone defect as a seen. B options compressions defect on a humeral head. Okay, so Venkart lesion actually soft tissue injuries, and Hill such lesion actually is a bone defect. Okay, B options correct options. 9 come to a 34 questions. Surgical neck fractures of humerus is common in. So surgical neck actually seen in the elderly patients, like elderly patients have a weak bone and osteoporosis, and for an outstretched hands is commonly seen in a elderly patients. So given us three options, correct options: elderly with the osteoporosis patients. Okay. Now come to 35 questions. Fractures of greater tuberosity commonly result in weakness of. So fractures like greater tuberosity. So greater tuberosity attached of a supraspinatus, infraspinatus, and a teres minor. So these muscles like help in a external rotations of a shoulder. So if a fractures of a greater tuberosity, so common weakness like a feel in a external rotations. Okay, so the options given are correct options. Now come to a 36 questions. Supracondylar fractures of humerus commonly cause injuries to. So in supracondylar fractures, it's common injuries as a median nerve injuries, anterior introsus nerve injuries, and brachial arteries injuries. But question asking here, commonly injured. So B options given are correct options. Median nerve injuries. Okay. Now come to a 37 questions. Most common complications of a supracondylar fractures in a children. So question asking a most common complications. So as a classic exam point of view question, so most common as a malunion, because actually seen as a gun stalk deformity is called as a cubitus barus. So gun stalk deformity is seen as a malunion process, not a due to nerve or vessels injury. So B options given are correct options. Most common complication is a cubitus varus, and most dangerous complication is a vulcanocemia contactus. Okay, so I think clear. B options given are correct options. Now come to a 38 questions. Intercondylar fractures of humerus is best described. So intercondylar fracture, as a break of both condyle, and like a joint is extended, so look like a T shape or a Y shapes on a X-rays. So B options given are correct options: intra-articular T or Y fractures. Okay, so intercondylar like intra-articular fractures, not extra-articular. So B options given are correct options. Now come to a 39 questions. Olecranon fractures most commonly occur due to. So olecranon like is a superficial bone on a elbow joints. So if a direct trauma, so like a fall on a elbow joints and hit against any of hard surface is commonly seen as a fractures. So options given a direct blow to a elbow, B options given a correct options. Okay, now come to 14 questions. Radial head fracture is classically associated with. So radial head fractures like radial head fractures on due to any of mechanism like force injuries, means fall on an outstretched hand and like force travel a upward direction. So radial head is absorbed this force, so seen as a fractures. So given a B options is a correct options. Okay. Now come to 41 questions. Montasia fractures is. So Montasia fractures means a fracture of a ala shaft and same time is a dislocation of a radial head. So given a options as a ala fractures with a radial head dislocations, B options given a correct options is a Montasia fractures. Now come to 42 questions is Galzia fractures involved in. So Galzia fractures, is a pair questions of a Montasia. Galzia fractures means a fractures of a distal third of a radius with dislocations of a distal radio ulnar joint at the same times. Okay, so given a B options is a correct options, distal radius fractures with a distal radio ulnar joint dislocations. Montasia fractures proximal problem है और Galzia is a distal problem, so don't be confused. B options given a correct options. Now come to 43 questions. Dashboard injuries classically lead to. So dashboard injuries very popular injuries like in RTA cases, knee like RTA cases knee hits dashboards, like force passes along a femur joints. So femur head pulls up backwards. So common seen as a posterior hip dislocations. A options given a correct options. Okay, dashboard injuries like a seen as a posterior dislocations. Please remember these points. A options given a correct options. Now come to 44 questions. Green stick fractures commonly seen. So green stick fractures like common seen in children. Like children bone have soft and flexible. So breaking easily, break on a one side or a bend on the other side, so it's called as a green stick fractures. So common seen is a C options like children. Okay, now come to 45 questions. Colles fractures deformity is described as. So Colles fracture actually are dorsal angulations of a distal radius, so wrist look like as a dinner fork deformity. So B options given a correct options. Colles fracture seen as a complications is called as a dinner fork deformity. Okay, so now come to our 46 questions. Smith fracture is also known as. So Smith fractures actually is a reverse Colles fractures because like seen as a Smith as a molar displacement, so it's called as a reverse Colles fractures. A options given a correct options. Okay, so now come to our next 47 questions. What in fracture is best described is. So what in fracture actually is a very important exam point of view questions. Actually what in fracture is seen in a distal radius intra-articular process. Okay, so like seen as a distal radius rim and seen as a subluxations or a dislocations of a carpal bone. So is a part of a intra-articular rim. So B options given a correct options, intra-articular rim fractures with dislocations. Okay, so I think it's clear. Now come to our 48 questions. Vanity fractures involved in. So vanity fracture actually seen at a base of thumb metacarpals, like include as a subluxations of a CMC joints. So seen as a first metacarpals with a CMC dislocations. So given a B options is a correct options. Base of first metacarpal with CMC dislocations, carpometacarpal dislocations. Okay, conditions like patient's pain in a thumb like movements is become a painful or unstable, so it's just seen as a fractures, vanity fractures. Now come to a 49 questions. Ronaldo fractures different from a vanity fractures because Ronaldo fracture actually is a part of a Bennett commuted fractures is called as a Ronaldo fractures like a multiple fragment. So Bennett fractures and a Ronaldo fractures as a same thing, but when it is a two-part fractures and Ronaldo is a multiple fragment fracture seen as a first metacarpals like CMC joints. Okay, so it's a communicated joints. Communicated fractures is like seen as a reductions is very difficult and the prognosis is very worse. So she options given a correct options communicated intra-articular fractures. Okay, I think as a clear. कोई भी ऐसा आपको कंफ्यूजन हो रहा है, डाउट हो रहा है, तो लास्ट वीडियोस में हमने इन डिटेल डिस्कस किए हुए सारे फ्रैक्चर्स, सो वहाँ पे जाके इन डिटेल आप समझ सकते हो, तो कोई भी एमसीक्यूज आपको टफ नहीं लगेगा, बहुत ही इजी हो जाएगा ये वीडियो आपके लिए. ओके, सो नाउ कम टू 50 क्वेश्चंस. Zephyrin fracture is fractures of. So is a very important spine MCQs. So Zephyrin fracture actually like a worst fracture of atlas C1, usually caused via axial loading and like diving injuries. So as seen as a lateral mass displacement, like a open mouth view in radiologically. So options given are B option C1 vertebra atlas joints. Okay. Now come to 51 questions. Ederson D. Alonso classifications. Type 2 odontoid fracture is located at. So please see this, like आप एक बार पढ़ लेना Ederson's D. Alonso classifications. Okay, because it's a very high yield classifications question. So Ederson's D. Alonso classifications, there are three types. Type 1 is a tip of dens and type 2 is a base of dens, like most common and most unstable, and type 3 as a body of C2. Okay, so question asking type 2 odontoid fractures is located. So type 2 is a base of dens, so B options given a correct options, because tip of dens is a type 1 and the body of is a type 3. Okay, so type 2 is a base of dens, like is a very worst prognosis, because most common seen is a like unstable. Okay, now come to 52 questions. Hangman's fractures correspond to which FND type when there is severe angulations with displacements? So it's commonly asked a spine MCQs FND classification. So please note down this. FND classifications as a type 3 होते हैं, type 1, type 2, type 2A and type 3. Okay, so type 1 is a minimal displacement and type 2 actually is a displacement plus with angulations, and type 2A actually is a severe angulations only, and type 3 severe angulations with a severe displacements. Okay, so question asking here severe angulation with a displacement, so is D options given a correct options, type 3. Okay, so type 3 has a severe angulations with a severe displacement. Okay, now clear. Now come to 53 questions. Clay Shobler's fractures is best seen on a X-rays. So clay Shobler fractures like seen as a spinal process of a lower cervical vertebra and upper thoracic vertebra. So spinal process are best seen in a like X-ray view or the lateral view. So given a B options, correct options, lateral cervical spine view. Okay, clear. Now come to 54 questions. Compression fractures of a vertebrae on X-rays typically show. So compression fractures like collapse of a part of a vertebrae and posterior height remains seen as a normal. So compression fractures like as a wedge shape. Okay, so options given are C options like loss of anterior vertebral height and plus a base shape. C options given are correct options. Okay, now come to 55 questions. Worst fractures radiologically hallmarks. So worst fractures as a very severe fractures and very dangerous injuries, because of worst fractures like a fragment is a collapse and move backward into the canal, spinal canal. So common chances in a spinal cord injuries. Okay, so worst fractures very cause like neurological deficiencies. So options given are C options like retropulsions of bony fragments into a spinal canal. Okay, C options given a correct options is a very dangerous injuries. Now come to 56 like Chance fractures is a best diagnosed in on which imaging. So chance fracture as a RT cases like a seatbelt injuries. So chance fractures like a flexions restrictions injuries commonly. So as a X-ray seen like a use in a vertebra to CT scans need. So because a chance fracture seen as a horizontal splitting of a vertebra because of seatbelt. Okay, so it's seen by the sagittal view. So CT scan is sagittal view. Okay, so C options given are correct options. Now come to a very important 57 tile classifications. Pelvic fractures type C indicate. So style classification is very important and very favorite pelvic fractures MCQs. So please note down this. Tile classifications, there are three types: type A, type B, and type C. Type A is a stable pelvis like a type A. Okay, and type B is a rotationally unstable but vertically stable, so is a type B. And type C is a rotationally plus vertically unstable, so C options are given are correct options. Type C is a rotationally and vertical unstable. Okay, so is type C actually, type C actually is a most unstable pelvic injuries, so C options given are correct options. Now come to a 58 questions. Straddle fractures involve fractures of. So straddle fracture, as a pelvic fractures like commonly asked in the questions. Straddle fractures means a fractures of both superior and inferior pubic rami, usually seen in a RT cases like motorcycle accident and trauma to a perineum region. So given a correct option C, both pubic rami and superior and inferior pubic rami. Okay, C options given are correct options. Now come to 59 is very important questions. Garden classifications X-ray sign of type 4 neck of femur fractures. So garden type classification is very important in a neck of femur fractures. So there are four type of garden classifications. Type 1 is valgus impacted, so is a type 1, and the type 2 is a complete with the unstable. Okay, sorry, undisplaced, and types 3 is a partial displacement and type 4 is a complete displacement. So question asking a type 4 neck of femur fractures, so type 4 is a complete fractures with a full displacement. Three options given are correct options. Okay, I think is it clear. Now come to a 60 questions on x-rays sentinel lines disruption suggestion. So sentinel line is very important for a diagnosis in a femoral neck fractures because sentinel line are smooth curved line between a inferior pubic ramus and a femoral neck fractures. So femoral neck, actually the options given are correct options, femoral neck fractures. Like if a sentinel broken, so it strongly suggests a neck of femur fractures. So it's very important questions. B options is a correct options. Okay. Now come to a 61 questions. AO classifications. 23C distal radius fractures mean. So it's very important, like AO coding actually as a 23C. So AO actually is a divided in three parts: A, B, and C. Okay, so A means a extra articular, and V actually is a partial articular, and C is a complete articular. Okay, so question asking like 23C distal radius fracture actually is complete articular. C options given are correct options. 23C is equal to fractures line under a joints plus metaphysis separate from a diaphysis, so is a complete articular. C options given are correct options. Now come to a 62 questions. Fragment type 8 distal radius fractures involves. So it's a very important MCQs fragment classification. Fragment classification is based on a radiocorpal joints involvement and distal radioulnar joint involvement and ulnar stoloid involvement. So given us C options is a correct options: radius plus ulnar stoloid plus radiocorpal plus distal radioulnar joint. Like type 8 means fragment classification is type 1 to type 8. So type 1 to 4 is a part of a extraarticular and 5 to 8 is a part of a intraarticular. So type 8 is a correct options is a C options. Okay, now come to our 63 questions. radiological features distinct coils from a Smith fracture is. So coils and Smith fractures is a main difference is the angulations, like directions of our angulations. Colles fracture is a distal fragment tilt dorsally, and Smith fracture is a distal fragment tilt as a bowler like palmary. So best radiologically is a bowler and dorsal angulation. So B options given a correct options. Okay, now come to a 64 questions on X-rays when it fractures shows. So when it fracture, as an intra-articular fracture at seen as a waste of first metacarpals and plus like a dislocations of CMC joints. So the X-ray seen like a radiologically show is a small triangular volar ulnar fragment. Okay, so small volar ulnar fragment is a correct options like C options. Small volar ulnar fragment with a CMC dislocations. Okay, so C options given a correct options. Now come to a 65 questions. Ronaldo fractures radiological appearance. So Ronaldo fracture actually is a comminuted intra-articular fracture seen as a base of first metacarpal. Like a comminuted fracture is actually shows a Y-shaped or a T-shaped pattern because is a part of a Bennett comminuted fracture. So Ronaldo means a multiple fragments. So C options given are correct options. Radiologically seen as a Y or T-shaped comminuted fractures. Okay. Now come to a 66 questions. Hawkins type 3 talus fracture X-rays show dislocations of. So Hawkins actually has a discuss. There are three types. Sorry, Hawkins has a four types. Actually, type 1, type 2, and type 3, and type 4. So type 1 actually is a undisplaced fractures, and type 2 subtalar displacement like dislocations, and type 3 actually subtalar plus ankle dislocations. Okay, so type 3 is a subtalar joints or a ankle. So given a C options is a correct options. Subtalar plus tibiotalar joints involvement is called as an ankle dislocation, tibia or a talus. Okay, so it's called as an ankle dislocations. And type 4 is a subtalar plus ankle plus talonavicular dislocation. So C option type 3 questions पूछा गया तो C options given a correct options. Type 3 actually is a seen very high complications of a ABN. Okay, so please note down this. Now come to a 67 questions. Radiological sign of posterior hip dislocations. So question asking about a radiological means X-rays. So posterior hip dislocations like a femoral head move away from the acetabulum. So if you see in a X-ray, so head of femur is seen as a very small. So the options given are correct options. Femoral head appear as smaller. Okay. So now come to a 68 questions. X-rays pelvis showing a teardrop sign disruption suggest. So if you X-ray show is a pelvic region, so if you see this teardrop sign, so teardrop sign actually is a part of a medial wall of acetabulum. Okay, so if a teardrop is broken, so like seen as a acetabular fracture, especially a medial wall. Okay, so B options given a correct option acetabular fractures. Very common questions for a Viva and MCQs. Okay, now come to a 69 questions. Most sensitive imaging for a occult neck of femur fractures. Most sensitive imaging. Actually, most sensitive imaging actually seen as a best in a MRI for a neck of femur fractures because X-rays may be a normal in a early fractures. CT scan miss a trabecular fractures because neck of femur as a trabecular fracture, so MRI detect a bone marrow edema as the earliest. So C options given a correct options. Best is a MRI because gold standard. Okay, so you can read now occult. Okay, now come to a 70 questions. Fat fluid level on a CT scan in a joints after trauma indicate. So fat fluid actually seen as a long bone and the intra-articular process because fat from a bone marrow plus fluid means a blood enter to the joints actually seen as a intra-articular fractures mostly as a long bone. So mostly seen as a common site is a fat fluid level as a tibial plateau fractures, and the fat as a lipo and fluid means a hemiarthrosis. So C options given are correct options: lipo, hemiarthrosis, intra-articular fractures. Okay. Now come to a 71 questions. Most common nerve injury in anterior shoulder dislocations. So anterior shoulder dislocations, like if anterior shoulder dislocates, so axillary nerve wind around to a surgical neck of humerus, right? So is a stretch in an anterior dislocation. So C options given are correct options: axillary nerve. Okay, I think is it clear? Now come to a 72 questions. Recurrent shoulder dislocation is most commonly due to. So recurrent shoulder, like repeated, so is a seen as a Vankart lesion. C options given are correct options: Vankart lesion, like avulsion seen in a anterior inferior glenoid labrum. So is a lead to the loss of stability and like a had keep repeated in a slipping on an anterior side. Okay, so C options given are correct options. Now come to a 73 questions is very important: need classifications. Need classification is commonly used for fractures of. So commonly actually used in a proximal humerus fracture as a surgical neck, greater tuberosity as a lesser tuberosity. So options given are B options correct options: proximal humerus. Okay. So please नोट डाउन दिस पॉइंट्स एंड जितने भी सारे हम क्लासिफिकेशन इस वीडियोस में डिस्कस कर रहे हैं वो प्लीज एक बार आप रीड कर लेना, बहुत ही इंपॉर्टेंट है. ओके, नाउ कम टू 74 क्वेश्चंस. नीड क्लासिफिकेशन कंसीडर हाउ मेनी पार्ट इन अ प्रॉक्सिमल ह्यूमरस फ्रैक्चर्स. So need like divides in a proximal humerus part in a 4 segments: head, greater tuberosity, lesser tuberosity, and a shaft. So fractures can be 1 part, 2 part, 3 parts, or 4 parts. So C options given are correct options, as a knee classification is a 4 parts. Okay, 4 parts is a consider. Now come to a 75 questions. Most common complications of a proximal humerus fractures in a elderly. So elderly, like most common complications as a shoulder stiffness and other complications like avian and malunion भी, non-union भी, but most common in a elderly patient as a shoulder stiffness like a frozen shoulder like. Okay, so C options given are correct options: shoulder stiffness. Because elderly patients age related and prolonged immobilizations conditions or a poor rehab, so C is the correct options. And maybe condition as a malunion भी C हो सकता है, but most common is just C options, stiffness. Now come to 76 questions. Fat pad sign in a elbow X-ray suggests in. So fat pad sign actually is a hidden fracture seen like normally posterior side, but fat pad is not a visual normally, but after any of trauma, so like seen as a joint effusion push fat pad, so this seen as a visually. Most commonly indicate as a supracondylar fractures in a children, and radial head fracture seen as an adult. Okay, so fat pad sign in a elbow X-ray is a B options, like occult fractures called as a hidden fractures. Okay, occult as a hidden fractures. Most commonly children like supracondylar fracture and adults seen as a radial head fractures. So please note down this. Okay, the options given are correct options. Now come to a 77 questions. Most common site of non-union in a forearm fractures. So forearm fractures as a as a both bone are fractures, like a very common seen in a middle third of Allah. Why? Because blood supply is poorest in a middle third, and is neglected and inadequately immobilized fractures. So seen as a middle third of Allah. I think is it clear? Now come to 78 questions. Night stick fractures refer to. So night stick fracture actually seen in a Allah, isolated Allah soft fractures. So B options given are correct options. Like same इसका mechanism क्या है? Night stick like person raise hand to protect from a sticks like a direct blow. So cause is a isolated fractures of a Allah, only a Allah. So B options given are correct options. Now come to a 79. Exact laparosity injuries includes in. So iliac laparoscopy actually is included in a radial head fracture, distal radioulnar joint instability, and seen as a interosseous membrane rupture. Okay, so options given are like distal radius fractures, radial head. Sorry, B option. A options given are correct options. Radial head fractures plus distal radioulnar joint dislocations. Okay, and they include as a interosseous membrane. Okay, so A options given are correct options. Now come to our 80 questions. Most common carpal bone fracture is. So I think आप सबको पता ही होगा. Most common is a scaphoid fractures. D option, B options given are correct options is scaphoid. Why? Because seen as a very common complications, high risk of a non-union and ABN conditions, and like if the blood supply is very poor, retrograde blood supply. So common sign as a seen in a tenderness in an anatomical snub box. So B options given are correct options. Scaphoid injuries, like mechanism is a fall from a outstretched hand. Okay, outstretched wrist. Okay. Now come to our 81 questions. Most common complication of scaphoid fracture is, so most common like as a avian of proximal pole, because due to loss of blood supply in a proximal fragment. So C options given are correct options. Avascular necrosis. Now come to a torque classification is very important. Torque classification is used for, so torque classification actually is very important for ankles, like torque classifications describe as acute Jones fractures and delayed union and non-union. So B options given are correct options. Zone fractures. Zone fracture is basically as a base of fifth metatarsals. Okay, so B options correct options. Now come to a very important. Waller angle is reduced in fractures of. So Waller angle actually is a normal Waller angle 20 to 40 degree. So is a reduced, like 20 to 40 is a normal. Okay, so if reduced like seen is a calcaneal compression fracture. So B options given are correct options. Calcaneal compression fractures is very common questions. Okay. Now come to our 84 questions. Important question classification. Sanders classification is used for fractures of. So Sanders classification is important for a calcaneus. So C options given are correct options. Okay. Now come to 85 questions. Most common site of stress fractures in athletes. So most common site as a athletes in a metatarsals, like second, third metatarsals. C options given are correct options. Second and third metatarsals, like sports activities and repetitive activities, common senior shoulders. Okay. Now come to 86. Loser zones or X-rays are seen in. So loser zone actually is seen in a soft bone due to a vitamin D deficiencies, means a poor mineralizations. So common seen as a pseudo fractures like ribs, pubic rami, and a femoral neck. So C options given are correct options. Osteomalacia. Common seen in osteomalacia. Okay. So I think as a clear. Now come to 87 questions. Most common pelvic fracture in a elderly. So in a elderly actually seen as a pubic rami fractures in a pelvic regions. Elderly is a minor fall or a like a low energy trauma, so fall from a standing height. So is a common seen in a pubic rami fractures. Okay, so B options given are correct options. Now come to our 88 questions. Acetabular fractures classifications commonly used in. So acetabular fractures, I think there's a clear C options like a Zudate lateral. C options is very important MCQs. Like two main types होते हैं, elementary fracture और associated fractures. Okay, elementary fractures is a Zudate like a divided in a simple pattern, and associated fractures like a complex pattern. So acetabular fractures plus classification almost always as a Zudate lateral. Okay. Now come to 89 questions. Most common complications after a posterior hip dislocations. So most common complications as a avian risk, higher risk, because posterior hip dislocations like a stretch and interrupt a blood supply, mainly a medial femoral circumflex artery. So B options given. Correct options A, B, and of femoral head. Okay. Now come to a 90 questions. Save time window to reduce traumatic hip dislocations to prevent ABNs. So save time window means वो टाइम जिसमें कि ABN के जो रिस्क है वो प्रिवेंट हो सके आफ्टर अ हिप डिसलोकेशन. सो इज अ विद इन अ 6 आवर इफ अ ट्रीट हो जाता है प्रॉपरली, सो एवियन के रिस्क है वो कम हो जाएंगे. आफ्टर अ 6 आवर सो इज अ वेरी डेंजरस because higher chance of osteonecrosis, so may need to a hemiarthroplasty. Okay, so 6 hours is very important. See options given are correct options. Now come to a 91 questions. A patient with dashboard injuries present with a knee flex during a trauma, which associated fracture is most commonly seen along with the posterior hip dislocations. So, dashboard injuries like a knee flex during a trauma in a RTA cases, okay, like force transmitted as a posteriorly to the hip. So, most common associated fracture is posterior ball of acetabular because femoral head is a push against a posterior acetabulum. So, is associated injury is posterior ball of acetabular fractures. B options is the correct options. Okay. So I think as a clear. Now come to a 92 questions. Which feature best differentiate a green stick fractures from a complete fractures on a X-rays? So green stick fracture actually seen in a children like a kid's bone is a soft and a very pliable. So as a two cortex present in a bone, one cortex if a broke, so green stick fracture seen as a one cortex broke and opposite cortex is a vent is called as a plastic deformations. Okay, so both cortex broke in a complete fractures, but a green stick fracture is a B options given a correct options. Plastic deformations with intact cortex on a one side intact होगा and opposite side क्या होगा, प्लास्टिक डिफॉर्मेशंस लाइक अ अपोजिट कॉर्टेक्स जो होता है वो वेंट हो जाता है, राइट, बिकॉज ग्रीन स्टिक इज अ पार्शियल ब्रेक इंजरीज, partial break fractures. So B options given are correct options. Now come to our 93 questions. Malunited Colles fractures most commonly result in which functional problem? So Colles fractures is a major complication is malunited because dorsal angulations is a reduced blood supply. So dorsal angulation most common functional issues as a reduce a grip strength. B options given are correct options. Reduce grip strength because dorsal angulation change is a mechanism of a wrist joint and a finger. So B options is a correct options. Reduce a grip strength. Okay. So now come to a 94 questions. Best management for an unstable Smith fractures with bowler displacement. So a question asking about a unstable Smith fracture. So if unstable, so you need required to a surgery, not used in a simple casting. Okay, so best treatment is a closed resistance plus any wiring. Okay, so options given are C options is a correct options. Closed reductions and percutaneous pinning. Okay, so very important for a displaced Smith fractures. Now come to a 95 questions. Volar-Wharton fractures is classified as a unstable primarily because of. So Volar-Wharton fractures. Actually, Wharton fracture is an intra-articular fractures and Smith and Colles fracture actually is a extra-articular fractures. Okay, so Volar fractures actually is seen in a distal radius with carpal as a subluxations. So is a part of intra-articular, not a extra-articular. So given us three options is a correct options. Intra-articular shear fractures with carpal subluxations. Because in this this fracture is unstable, so because fragment is a articular plus carpal bone is a pull, so tendon pull alone is not main reason. Main reason is a carpal instability like subluxations. So C options given are correct options. Now come to a 96 questions. Compared to Vanette fractures, Ronaldo fractures has a poor prognosis because of. So, compared to a Bennett fractures to a Ronaldo. So, Ronaldo fracture is a comminuted intra-articular fracture of first metacarpal space, and the Bennett fracture is a two-part fracture, usually a better prognosis compared to the Ronaldo fractures because both are seen in a first metacarpal thumb. CMC is one, but Bennett is a two-part fractures and Ronaldo is a comminuted fractures. So, Ronaldo fracture is a poor prognosis due to a communications of a articular surface, and Bennett fracture is usually a better prognosis. So given options like she options communications of a articular surfaces. Okay, I think clear. Now come to a 97 questions. In instability in a Zephyr fracture is best assessed by which radiological finding? So in instability in a Zaffarjan, do you know Zaffarjan fractures seen in a C1 fractures, C1 worst fractures. So West X-ray finding or instability for a lateral mass like displacement as a seen as a open mouth view. Okay, so given a like correct options is a lateral mass displacement on a open mouth. B options given a correct options. Instability in Zaffarjan fractures in seen in a radiologically. So like seen as a open mouth view. Now come to a 98 questions. Clay soblar fractures is considered stable because it's involved in. So clay soblar, as a avulsion fractures of a spinous process commonly in a lower cervical and a upper thoracic region. Okay, so it does not involve like vertebral bodies or a canal. Is only a involvement spinous process. Okay, so because it is involved as a C options is spinous process only is the correct options. Now come to our 99 questions. Which features on a CT scan makes a worst fracture surgically significant? So worst fracture is a very dangerous fractures because of vertebral body fractures. Okay, so vertebral body actually is a fragment is a multiple like commuted type of fracture. So vertebral body species in a enter to the spinal canal. So most of the canal compromise via like a retropulse fragment. So need to a surgically. So in a X-ray or a in a CT scan, if you see this retropulse fragment in a canal, so need to a surgically. See options given a correct options. Canal compromise via retropulse fragments. Okay, come to a very important and the last MCQs of our videos. In garden type 3 fractures, neck of femur in elderly patients prefer management is. So garden type classification is very important for a neck of femur fractures. Question asking about a femur fractures, neck of femur fracture in elderly patients. So type 3 is a partially displaced femoral neck fractures. Okay, in elderly has a very high risk of a ABN and a non-union. So prefer a management like a hemiarthroplasty. So C options given a correct options bipolar hemiarthroplasty. Why do not use on a screw? So because elderly patients maybe osteoporotic bone, maybe chances to a fixation is a failure risk. So C options given a correct options bipolar hemiarthroplasty. So I think as a clear. Today's we have covered all 100 MCQs on a fractures. So I think as a clear. Is a very informative videos for all exam, all competitive exam like GSSSB, MPESB, Aiims, DSSB, MPT, any other exam. Because fractures questions asking out 2 to 3 questions. Okay, so if you had any doubts or a question, so feel free ask in a comment below. And request to you, don't forget to like, share, and subscribe to channel for more videos. And we will meet you in the next class. Thank you so much. Keep supporting me. Bye bye.